Hello and welcome to Seaview Orthopedics Sports Medicine Roundtable. Today's topic is about pickleball. I am a shoulder specialist in the shoulder division or sports division of Seaview Orthopedics. Pickleball has gotten a huge following lately, especially because a lot of people who play tennis couldn't get around the court, and now you have a lot less court to cover. But we're noticing similar problems are with presenting shoulder symptoms. And when we ask some of the questions to these patients about things that have been problems, we've noticed that a lot of people seem to ignore things that are the warning signs and things that you should be looking out for. Number one would be reaching behind the back or being able to scratch your back. A lot of people, it's been months or years, and they can do a lot of damage to your shoulder if things are that tight. Oftentimes that's easy to deal with a stretch. Number two would be the pain with drawing the sword or popping and clicking with that move. That's a sign that the shoulder is not staying centered in the socket. And then number three is getting one of the common things that brings people into the office is pain at night, especially if you're a side sleeper on that shoulder, either with the hand above or below, or if you're a face sleeper and your arms are over your head, because that is forcing your shoulder forward, which is stretching the front for hours and hours while you sleep. So all of these things are things that seem to come up very commonly in conversation, and it seems that people are ignoring them, thinking that they're just a little bit older. Well, I used to play tennis, whatever. In reality, this can happen to young people, old people, and it will make your shoulder miserable. You won't sleep well. You won't be able to function. A lot of it affects your overhead reach, and it's something that oftentimes is very easy to treat if you catch it early enough before damage gets done. So don't drive with the engine light on and do more damage to the vehicle. Bring it in, let us see you. A lot of times when you catch these things early, there'll be something that we can treat without surgery. Whereas if it's left unchecked and you go around with these clunks and clonks going on in your shoulder, that's doing damage because the shoulder's not staying centered in the socket. And that can make it a much more long recovery. So come into Seaview, Dr. Thacker, this is Dr. Pandya, one of our head PTs. We're happy to take care of you and looking forward to seeing you and hopefully getting you ready for the spring season to come up. We've all had a pretty miserable winter, so I'm going to get you guys back out there on the court.